Hi, everyone. This is Caitlin from GrassFedGirl.com, and I'm so excited today. We're here with Janae Cywes, and she is the wife of Dr. Cywes, and she is also expecting, and we are due almost the same time. So we thought this would be a fun interview. Welcome, Janae.
Thanks, Caitlin. Really appreciate it. Thanks for having me today.
Yeah, it'll be fun to talk to somebody who's going through the same things as me.
That's for sure.
Yeah. And so tell us a little bit about your story, like how you got interested in health and what led up to some stuff leading up to your pregnancy and stuff like that.
Sure. So I've always had an interest in health. I actually have a health science degree, a bachelor's and a master's. And so I always took a lot of anatomy, physiology, was very interested in the human body. I worked in the healthcare field as a speech language pathologist for about 8 years before I switched my career to go into sales/account management. And but I always kept that interest in health. And one of the other videos that my husband and I did, we talked a little bit about our background story, but I'll give you the short version as well. I actually, once I switched careers and went into sales, I was always really big into athletics. I played a lot of beach volleyball, and in high school, I was a 4-sport athlete actually, but I continued that into my young professional years. And I noticed when I switched into sales that I was traveling a lot more, and I wasn't maybe paying as much attention to my diet. And we were doing a lot of entertaining, lunches, dinners, etc. And I started noticing myself getting rounder around the edges. I wasn't really, overweight per se, but I was just feeling not as fit, even though I was working out just as hard as I always had. So that's really when I took a look at the carbohydrate content of what I was eating. And I was quite shocked that, the standard American diet is really heavy in carbohydrates, obviously. So I actually took it upon myself, and this is all prior to meeting my husband, to really cut down on the carbs. And I was doing a little bit of the high fat, but as I've told other people, I really increased the fat intake once I met Rob, and we kind of bonded over this similar lifestyle that we were living. So that's really what got me into really low carbohydrates. And then after meeting Rob, of course, I started into the high fat as well.
Okay. So how long have you guys been married?
So we've been married just over 3 years now. So we're still newlyweds.
Yeah.
But we, the story of our first date is always interesting because, like I said, I didn't know what he did except for the fact that he had scrubs on. So I assumed it was something, when I first met him, I assumed it was something in the healthcare field. But it wasn't until we went out for our first date that we started really talking about the dietary side of things, because the waiter had come to the table with a bread basket, and we both kind of shooed him off. So that was our first entry point into discussing, our diets, et cetera. And that's really when Rob and I started talking about the high fat. I told him I was doing low carb already, and I had noticed a significant difference when I was traveling a lot, exercising a lot, playing a lot of beach volleyball, but just that little change of decreasing the carbohydrates. And I was doing, like I said, I increased the fat a little bit, not a lot initially. So we chatted over that over dinner, and really it was a very cool connection for us. And then he really started talking about the benefits over the next little while of the higher fat content. So I started increasing from there. So that's really kind of what started down the dietary journey. But I've always had an interest just in health and the human body, et cetera, from working in the healthcare field.
So did you guys meet in like a hospital or in medical setting, or?
That's what everybody would think. That would be the most logical conclusion, but we actually met in an elevator. So the funny story is that I loved what I did in healthcare. I was able to help patients every day, patients who were rehabilitating from strokes or traumatic brain injuries, or people who had Parkinson's, Lou Gehrig's, just a variety of dementia patients, a variety of different patients I would see, but I was always able to help them in some way or help their families. Whether it was through swallow rehabilitation, because that's a big part of speech language pathology with dysphagia, or if it was speech or language rehabilitation or cognition. So it was a really, really rewarding career, and I loved it. But at some point, over the 8 years after graduate school that I did that, I was working mostly in the geriatric population, between hospitals, home health cares, assisted living facility. I was really working with geriatrics 95% of the time, I would say. And I just wasn't really exposed to other young professionals that often in those facilities, and especially going to people's homes. So at some point I said to myself, if I keep doing this forever, I love it. It's very rewarding, but I'm never going to meet anybody, to have a relationship with. So that's when I kind of decided I was going to change my career, and I would go out and travel when the business people were traveling, and I would be exposed to so many more young professionals, and I would get out to other cities, and I certainly would meet somebody then. So that was the idea in my head, was that I would, be exposed to so many more people outside of the city where I was living. And then as life would have it, the way we actually met, Rob and I, was he actually had a condo in the same condo building that I did. So he was on the second floor and I was on the fifth floor. So he was literally under my nose the whole time after I'd made the decision to go out so I could meet someone.
That's funny. So so you saw each other several times. I mean, just in passing, probably.
Correct.
And he was like, hey.
So what happened was, the very first time I saw him was in the elevator. So, and I found it funny that he was only going to the second floor, and he told me later that he would always take the stairs. He never took the elevator. But this one day he followed me in as I was on my way home from the gym, and I looked horrible. I was all sweaty and no makeup, and I looked really bad. And, but he followed me in the elevator. So we basically had one floor of time, and I looked at him and I said, are you new here? And he said, no, I've lived here about 18 months. And I said, oh, I travel all the time. He's like, yeah, I'm between here and South Florida. So, I'm in and out a lot too. And so I said, oh, well, it's nice to meet you. And he said, nice to meet you too. And he went off the elevator, and that was it. And I thought, that guy was really cute. And I liked the accent.
Of course, yeah, you noticed that. That's great. So, well, tell us a little bit about your journey up to getting pregnant.
Yeah, so we definitely have had, it's been a long journey. It kind of started with, we got married, and we actually got married relatively quickly. We'd known each other for about a year, and a little longer than a year, but we'd been dating about a year. And we got married, and we had this beautiful wedding in the Florida Keys, our favorite place. And we told the story of our honeymoon to a lot of friends and family, and I think we've done a video on it as well. But we went off on our honeymoon in Greece. Somebody actually gifted us a honeymoon, which was like the best gift ever, because we weren't going to take one. So we got fortunate enough to do that over that summer in July. And when we got back from the honeymoon, we actually kind of fell off the wagon a little bit with our diet. So, and I tell everybody, Rob does a lot about addiction and emotional management and all those things for those who follow him. And the point that I make is it's not always the result of negative emotion or sadness or, stress or anxiety. It can be the result of positive and happy emotion as well. So, we had just come back from our honeymoon. We were happier than ever, more in love than ever. We were just having a great time, getting to know more of our neighbors and our community, and really starting a life together. It was a very, very, very happy time in our life. But I discovered a little thing known as peanut butter M&Ms. And so I indulged a little too much. I was always really able to really control my diet very well, especially once I started doing low carb. It was like a no-brainer for me. It was just, it is what it is what it is. It's how I lived. But when I discovered the peanut butter M&Ms, I went a little overboard. And Rob always says there's a difference between abuse and addiction. So he says, for me, I'm able to kind of do a short-term abuse, and then I can turn it off and go right back to the lifestyle before. But for him, once he starts down that path, it's truly an addiction, and he has a really, really difficult time getting back on track. So I
you sound more like me.
It's like, so there's those little short-term periods of abuse, and that's what we went through. It was probably a month or so, but the sad part of that was I started having some, more reflux. I had some gastritis. I wasn't feeling that well, literally, because I was just kind of taking a left turn off of the normal path. And So we got some blood work done. We noticed my numbers were higher than I had ever been before because, like I said, I'm typically really good at staying on track. So so we knew I needed to get back on track. But at the same time, because I had digressed, Rob really did as well. And he really went off the path. So it was very difficult for him, especially, to kind of get back on track. And once we took a good look at my blood work and said, look, we're going to have to change something here. That's when I really sat him down and said, I think we both really need to take a hard look at this and work together to get back on track. And that's when I really brought up potentially having a baby. And that was very difficult.
I hope you talked about it before you got married.
We talked about it before, but we were both later in life. I mean, Rob and I have an age difference, but even for me, I was an older bride. So we were kind of the mindset, like, if it happens, it happens. If it doesn't, we'll be okay with that. So we were kind of, in that whatever turn life takes, we'll be okay with that. And then I would say after we got married and kind of went through that difficulty with our health and everything, is when I said, well, maybe we could sort of, it was like before we were not trying, but we weren't trying, but we weren't not trying, if that makes sense. And so I said, maybe let's get a little bit more intentional about trying. And it's still of the mindset, if it happens, it happens. And if it doesn't, it doesn't. So that was basically the conversation was, could we maybe get a little more intentional about trying? And it was tough for him because of our age difference. And he has 2 kids that were almost out of high school. So he really had to wrap his head around that for a while and come to terms with, because his greatest fear would be that he wouldn't be around to see out the end of that child, or, into that child's adult life. So it was an emotional time for me, for him, about whether we would try to really get intentional about trying. And finally he came to the conclusion. He did the very selfless thing of saying, okay, let's go ahead and start being more intentional about this. So that was probably about a year into our marriage by the time all of that was said and done. And also I travel for work. So, just logistically, that's challenging. But then from that,
the ovulation days.
Exactly. So that's what became a bit more of a logistical challenge for us, was just ovulation.
And take a trip that week.
Exactly. And, when you work in business and sales, there's not a lot of ability to work around them sometimes. So it was challenging.
You don't want to tell your boss, that's the day I'm ovulating.
Exactly. That's a tough conversation to have.
Yeah. I mean, like, my clock is ticking.
Yeah, that's for sure. So anyway, it was and then that was really where our journey started. And what I think the biggest thing that changed when we got more intentional about trying was just the emotional side of it, right? Because then you're a little bit more invested. I think no matter how much you tell yourself don't have expectations, you sort of do. And it's hard when it doesn't happen. So, whether it was a timing thing, and that's another thing I would say is that, and I'm really interested about your journey as well, and especially the carnivore piece of it, because my cycles were sort of, I don't want to say all over the place, but there were periods of times when they were all over the place. And to get into that really regular 28-day cycle is actually when we started going more on the carnivore side. Somebody asked me that recently, and about the benefits or drawbacks of females specific to hormones and cycles and things with carnivore. They were concerned about that. And I told them, actually, when I went carnivore is when mine really straightened out. I started really being regular 28-day cycles.
Wow.
when we went more on the carnivore side. So that was very helpful. And then also I tended to have acne problems, and that got much better when we went carnivore as well. So 2 things from sort of a hormone female perspective improved tremendously when we got more on the carnivore side of things. So Yeah, so that was kind of the starting point. We got even healthier with our diet. We got more intentional about days and travel schedules and everything, but it was still challenging. And whether we were missing the day by a few days here or there, or or missing it altogether because of my travel or Rob's travel, he was speaking at conferences. Sometimes we'd try to figure out the day and say, okay, well, maybe he can fly out to where I'm at that week for work. But schedule with patients and surgeries is also really challenging. So we went along. Yeah. So it really was. It was about 18 months of, basically that's 18 times of trying, or to the best of your ability trying, and that's 18 disappointments. And so for those women out there, those men out there who are going through something similar, I would say just don't give up, keep trying. It's, we had a lot of months where it was, again, and then at some point we sort of thought maybe it's just not going to happen. And again, we had to go back to the fact that before getting married, we had always said, if it doesn't happen, it's okay. And we'll still have a wonderful relationship and a wonderful life and all those things. So we had to draw on a lot of that strength and our faith and all that. So yeah, that would be kind of what I would pass along to anybody going through something similar, in that you never know about the time you give up. I mean, about the time I had given up on finding a man or a partner is when Rob walked into my life. And about the time I was giving up thinking that I would have to be okay just not being a mom is when it finally happened. So I think just to have hope.
Okay. Don't make me cry. I'll cry at anything. Well, I think that now, did it help that he was a doctor? Did he know more than other people, or was this not his specialty at all?
No, it's interesting. It actually is very much his specialty. So Rob has a really varied background. I don't know how many of you know his true story, but he was trained as a physician in South Africa, which is where he's from. And then he actually came over to the United States during the apartheid era, and they didn't let any of his education count. So he had to really start over. And the first place he was at was Ohio State. And then he actually went up to Toronto, to the University of Toronto. And he actually did a Ph.D. there, was there for 7 years. And then he came back to this country to Michigan. And that's where he did his pediatric surgery work, was at Michigan. So he always says he has 19 years of higher education, which is why he's brilliant. One of the reasons why he's brilliant. But he says that he was just not as smart as everybody else. It took him longer, which is not true. But he does have a lot of years of higher education. So his PhD work that he did was really with a heavy interest in metabolics. So he was very interested in the liver. They actually were doing transplantation work. So he actually, and he has this really deep mind and knowledge of physiology. And he's always his training was to always ask why. So he always takes things back to a basic level as why this is happening in the human body. And he's excellent at doing that. So he's never just going to look at a symptom and say, here's the medication, right? That would be his last approach ever. His is always look at the symptom. Why is this person having this symptom? And really get to the root of the problem, because you're never actually going to truly solve the problem until you get to the root of it. So that's just how his mind works. It's how he was trained. And I'm very thankful for that, because as we were kind of going through our journey, it was incredibly helpful. Not only the background in the research, the PhD, but then also the pediatric side of it as well. So he's also an expert in embryology, human development, baby development, brain, everything. So that was really helpful to have that knowledge. And I wish everybody could do that. But I think that's why we've been putting out some videos on this topic as well. We're hoping that we can share some of that knowledge with everybody else.
Yeah, I think so many people, they're under the illusion kind of that if you just keep trying, like keep having sex and that's it, that's enough. And I think that's really, I mean, they haven't looked into it enough at all, and you need
Right.
to be more proactive, much more than, well, I mean, there's so many things you need to do before besides just, because I think also people just do it whenever, and it's like, that's dumb, then you have to learn so many things about your body. I mean, the man, I guess he doesn't, but the woman does. And you have to time it so much, and there's just so many things. And then also going, if you are having problems, going and getting checked out. And did y'all do that? Like, go get checked for, optimal function on both sides?
Yeah, we did. So, Rob obviously does a lot of studying of, like I said, just physiology in general. So he has always done routine blood work on both of us. We always make sure our labs are in order and everything. But of course, we still did seek out, a couple different OBGYNs actually, just to make sure everything was good. And when I first mentioned that I had some irregular cycles, their first thought was, okay, she must have PCOS, because they see so much of it in today's society with our standard American diet. So, and Rob assured this OBGYN that I did not have PCOS because of the lifestyle that we live. But he wanted to, check and scan and make sure everything was good anyway. So he did. And he said, well, you were right, no PCOS. So, but that's a huge part of it. And Rob actually, as a big part of his practice working in the metabolic space, is he sees actually a lot of patients who go through fertility treatment. And the biggest cause of that is the PCOS. But he always says as well, don't forget that low testosterone is also a piece of that, which is also a direct consequence of carbohydrate consumption. So even though you said it's really the woman that has to take, more note of her body, I think it's an important note for the men as well. Don't forget, there is definitely a man component to this, and the low testosterone is a big piece of that. So really, both partners should get their lab work checked and be monitored in that regard. And then, of course, seek out the OBGYN as well. And then also, we just had some other things in some of the family history, some genetic things, so we sought out consultation for all of those things and did see various doctors. So we were very thankful for all of that, and it's just really neat when you have it. I know not everybody's fortunate enough to have, but when you have a husband like mine that's a physician and very astute at what he's doing, to hear them talk in their medical speak, it's like, I just sit back because I clearly cannot follow that level of detail, but even about the embryology of everything. So
yeah, you have an advocate there for you.
Exactly. Exactly. So it was like I said, it was definitely a learning. I learned so much. I think Rob even learned, things along the way. And he was very thankful to have those collegial kind of talks, not only, from a professional standpoint, but then it's obviously very personal to us as well. So it was just, it was really a great experience all the way around with all the providers that we sought.
I know people are going to ask, they're going to ask how old you are, but you don't have to say if you don't want to.
I have no problem. I'm 38.
Okay.
38. Yeah. Considered geriatric in a pregnancy.
Yeah, they don't mince words when you're in those places. Now they say advanced maternal age. They say that's a little nice. Sounds a little nicer.
Yeah, I do think that. So I saw one report recently, one of my reports, that said elderly too. So it's somewhere between elderly, geriatric.
Oh, yeah, I think I would freak out if somebody said that to me. That word was very triggering.
Yeah.
So you said you went carnivore. So when did you start that? You started.
So, yeah, I would say we got more serious about carnivore probably about maybe 9 months into being a bit more intentional about trying, because my cycles were still a little bit off. I mean, I might hit 26 days or 29 days or 31 days, but I was in the range. But once we said, okay, let's just, that's when I think carnivore was starting to get a little bit more momentum in general. And so Rob was very interested with his professional colleagues, the Ken Berries, the Sean Bakers of the world. And he was presenting at a lot of conferences with them. So he started gaining more of an interest in it. And so we decided, well, it's not going to hurt. Let's try. And that really, like I said, between the skin really clearing up and the cycles really hitting on 28 days almost exactly after that, it was, I think it was a significant benefit. I've never been, I wasn't into certainly the higher carb vegetables, the carrots, the corns and things. I might occasionally have something like that, maybe once every 6 months, but I was still doing, tomatoes and avocados, or I still do avos now, but cucumbers. I would still do salads pretty regularly. And so then I really just transitioned just to the meats and dairies. And that really got me, like I said, pretty almost precise with cycles and things. So I do think that was very helpful.
Yeah. So about maybe a year before you got pregnant, you did that, or?
I would say about 9 to 11 months before I got pregnant.
That's great. I mean, because I think a lot of people think diet has no impact, and which is crazy. So what's kind of your typical day of food now?
So now, since I have been pregnant, and tomorrow I'll be 28 weeks, and you're almost at that as well, right?
I think I'm 27 weeks yesterday.
Okay, so we're maybe a week off. Once I did get pregnant, the early part of my pregnancy, from about 6 weeks to 16 weeks, is when I had a little bit of a rough patch with nausea. And it wasn't morning sickness. Mine was all day sickness, really more intense at night. And so I would try to really opportunistically eat when I wasn't feeling as nauseous, which was typically in the morning. So I would, do a lot of eggs and bacon, cheese, my whole milk, all of those things. I got a little bit away from those just the carnivore, because I found some of those things in that period, some of the veggies and things, a little bit more
appealing.
Tolerable. Yeah, exactly. So I did do a little, that's really, I kind of put vegetables back in my diet at that point. And I have never had any, which I find interesting, and I'd love to hear your side of this as well, but I never actually have had any cravings during my pregnancy at all. One of my girlfriends said something to me about the other day. She was thinking about Chick-fil-A or something. And I told her, goodness, I haven't had Chick-fil-A in 100 years. But I remember the days when I used to eat a standard American diet and having those little chicken minis for breakfast. And so I told her, I remember those days, but it was a distant past ago. And she said, oh, I hope I didn't just trigger a pregnancy craving for you. And I said, no, I actually have not had any at all, which has been a true blessing. So I didn't have any cravings, but I did have some aversions. I actually had an aversion to red meat during that kind of 6 to 16 weeks period. So I wasn't eating steak, which is so funny because we love steak. We eat so much steak. I'm sure you guys do too. And I just told my husband today I would love to have a steak tonight. So anyway, but it was more just the aversion to red meat for me. So I really stuck with the pork, chicken, and fish through that period. But yeah, that was kind of, it seems fleeting now. At the time, I'm sure it was not as enjoyable, but about 10 weeks there where I was going through some of that. And then now my daily is it's about 12:30 an hour or so. I have not yet eaten today. Before getting pregnant, I was pretty much OMAD. My husband and I both were. I'll drink things throughout the day, whether it's unsweet iced tea or water or a cup of coffee here and there. But mostly we just eat one meal, and that's our dinner meal. But then when I got pregnant, I said, okay, I think I need to increase from the OMAD. So I've actually been doing 2 meals a day. So, but I still am not hungry. So it's almost like you kind of have to force yourself. So, so I'll probably have my first meal, you know, when we get done here or whatever, maybe 1 or 2 o'clock. We'll probably eat dinner about 5 or 6 o'clock. I have to be careful of that because I do have a little bit of reflux with the baby pushing up at night. So I don't want to eat terribly late. We were doing that for a while because my husband gets home so late from being in the OR. So we were eating pretty late, and I had a couple nights that were a little bit uncomfortable. So I told him, on the nights you're late, I'm going to have to eat a little bit earlier. So, yeah, eat 2 meals a day now.
Yeah, well, I had a red meat aversion also from probably about 6 weeks to 12 weeks to 13 weeks. I couldn't, maybe if I got in a restaurant or Wendy's, I mean, you couldn't even go to restaurants most of the time because, but like a Wendy's, I could eat that if it was like given to me, you know, but I couldn't cook it or buy it and then like handle it, or it was just like, ugh. But then it went away, and so now I'm back to, and during that I ate a lot of chicken, and I ate fish, and I ate a lot of goat cheese and eggs and stuff. I can't eat a lot of dairy because it gives me a lot of congestion, but I can eat goat cheese or like sheep cheese. But yeah, definitely have the red meat aversion, and I do have sugar cravings. So I just eat like some keto ice cream or something like that sometimes, but that's pretty much. But I haven't had any inkling to really eat vegetables. I've had like a couple of avocados or maybe some. I really can't do the big salad. That doesn't appeal to me. Maybe if I, like the other day, I had some ceviche at a restaurant. That was like the first time I went to a restaurant. And it had some avocado and it had a little onion and some stuff. I mean, I kind of picked around it, but it does give me like a reflux if I eat a lot of onion or garlic or herbs even. So I just really don't want, and I mean, anything will give me reflux, like you said. So, so anything extra, I don't really want it, but
Sure.
My husband loves to put herbs and all this stuff, seasoning in our food, and I'm like, let's, I know what's gonna happen. I know it's gonna be like gurgling, like, oh, whatever. I mean, if I eat by myself, I usually just put salt on my meat and stuff. But I started eating 3 meals a day because when I was first pregnant, I could not. I would get very sick if I didn't eat like on the dot. Like I would start feeling like I was going to pass out or something, like if I didn't eat 3 meals a day, I would just get really weird, and I feel like I had to sit down, or like I feel like I was going to get nauseous if I didn't eat. So it was like I had to make sure I was close by to the food but now I can eat about 2 meals now. It just depends. Sometimes I'll eat a little bit of eggs or something early, but that doesn't really stick with me that long. And then I'll eat something bigger, like a little later, but definitely not OMAD because I need, it doesn't feel good for me to eat a lot and at once. But anyway, so what are you doing about the glucose monitoring or the whatever that juice they give you or whatever it's called?
The oral glucose tolerance test. So because I often do wear a CGM, I actually don't have it on right now because the tape actually was giving me some itching. So I was having a little bit of a reaction to the tape around it. So I took it off. But I do wear it most of the time. And that's really just a great biofeedback way to monitor what the glucose is like. And mine stays really pretty stable. Obviously when you eat, you see the rise and fall. With physical activity, you see the rise and fall, but it's not your standard roller coaster that we would see from somebody who's on a standard American diet. So we really have just kept, and obviously, and then Rob has also, again, continued to do routine lab work on me just to make sure everything looks good. And he reviewed some of that on one of his recent videos, and everything is really, really good for pregnancy. So we actually are not going to be doing the oral glucose tolerance test. It's a really antiquated test in general. And when you interview Rob, he can tell you more about why, but there's much better ways to get the data now for pregnant women than that, especially because they make you drink that, whatever, basically puts you into insulin resistance. So we would opt not to do that, and we just are monitoring it ourselves.
So you just show them, maybe take them a report of your numbers or something like that.
Exactly. And my OBGYN, who's actually going to, deliver us ultimately, and Rob are actually obviously colleagues, and he's very well aware of what Rob does and vice versa. So they stay in regular touch about that. But again, I think the important piece of that is that all women really should take their health into their own hands. And I think a lot of times we're forced by doctors, and a lot of it is because most women out there are on the standard American diet. They're going to see a very high incidence of gestational diabetes and, the PCOS and things, the precursors to pregnancy. But so I don't fault them for it, but it's sort of their textbook medicine approach, is that everybody gets this same textbook treatment pattern, and it doesn't fit for everybody, especially people like you and I who have really taken our health matters into our own hands. So I think we have to be advocates for ourselves when we are going through something like this.
Yeah, I was afraid of how I would react to something like that, because I think it wouldn't go well because I don't eat that kind of stuff, and I don't know that I would have a good result. So I wouldn't want to be like almost railroaded into having to defend myself or something like that. So I don't have a CGM. I'm working with a company. I think they're going to send me one, but I didn't think it was not on time. So I've been just doing the finger prick with the Keto Mojo, and I've been doing it for, I think, about a week now. And it is interesting though to see, like, if I do eat something with like artificial or natural sweeteners, that it does go up. And like my body is much, much lower when I eat, like it's about 80 when I wake up, if I don't eat any kind of treat or anything. But then if I do, it's like 92 or something, like when I wake up. So it's like your body does react even to the artificial sweeteners or whatever. So, I mean, it's good for me to see, like, okay, you really don't need that. Like, just eat some meat and eggs or whatever. So, well, what's your birth plan? So you said you're going to have it with its OB/GYN, that's your husband's friend, and.
Yep. So we actually we are going to have a cesarean section. Actually, one of the things that we found, I think it was at our 22-week ultrasound with one of Rob's colleagues from Vanderbilt, actually, who's really this world-renowned maternal fetal medicine specialist. And he saw that my umbilical cord was not coiled like typically you would see, which means it's a little bit shorter. So for that reason, we are going to have a C-section. So at my next appointment, which is in a few weeks, we'll schedule that for, I think he said probably around 38 weeks, and then hope that we make it that far. So that's really the plan. So, and I think probably I've, read some blogs and moms that say they were really disappointed when they had to have C-sections. They really wanted to try to have naturally, or their doctor was pretty sure they needed a C-section, but said that they would be able to try naturally first if they really wanted to, et cetera. So I think everybody has a different story in that regard. I've just kind of accepted that ours, it is what it is. And actually Rob, being a pediatric surgery, would prefer that anyway, because he's seen a lot of births go badly, and he really says in terms of safety for mother and baby, a C-section is perfectly safe. So we both come to terms with that. We're fine with that, and it'll be scheduled, but we will hope that we actually make it to that scheduled date. So
well, most of the time it's beyond that for first time moms, right? Like 42 weeks or something. Well, yeah, but I mean, I think if you guys are aware of all the different things, and I'm sure there's something you can do, like about the probiotics or whatever you get for the birth canal or something. There's some way you can make that up or whatever. So, I mean, I'm sure with all the knowledge you guys have that you can make it the best experience that will be. And so what are you doing about your baby shower?
Well, I'm curious. I want to ask you how you have felt being pregnant during COVID, because this is obviously a very different time in our world. So I'm trying to reach out to all my pregnant friends and colleagues and things and just check on them all the time. So I'm curious how you've been dealing with it.
Um, well, at first it was harder because my parents were very into quarantine and they didn't want to see me, and because my husband was still working, and so they thought we were like contaminated. And my sister also was kind of quarantining with them because they live across the street from each other. So that was probably the worst part because they were like, we're not gonna see you. So I was like, okay, I don't know what I'm supposed to do because my husband had to keep working. And um, so, but now they've kind of loosened up a little bit, and they would see me maybe in the yard or something like that, like sitting far apart. Or so that was probably the worst part for me because we live here because of them. Like we moved here so we could be with them and stuff. So it was like, what? But anyway, that was probably the worst part. But it's gotten a little better now, and my sister is not quarantined. My sister has two small children, so to not see her children, my nephews, was like the worst. But they seem like they're loosening up a little now. So, and I hate not shopping because I'm a foodie, and so so not going to the grocery store was pretty bad. But then I was like, after about a month or so, I was like, I'm just gonna wear my mask and go to the grocery store because I can't stand it. I have to hunt and gather. It's like a a need in my hierarchy of needs. So
It's been a challenging time for sure. So I started watching the coronavirus stuff back in December, really, when it was we were just getting the early reports out of China, because I do travel for work. And mostly where I was from October of 2019 through March of 2020 was in San Francisco, the Bay Area. I had a lot of ongoing work at that time with Stanford Children's Hospital. And so I felt like I was living in San Francisco during that, fairly long extended period. And that was very worrisome to me because of the direct connections, all the daily flights in and out of Asia to San Francisco. Obviously, there was a big risk there. And then the second most common place I was in that time was Los Angeles. So same thing. So I was actually concerned. And I, to this day, am not 100% sure that I wasn't exposed at some point in there. And of course, we didn't know that I was pregnant either until sometime in January. So, and then I was still in those locations for about another 8 weeks after that. So it was really worrying to me. And I was watching kind of early reports of it. And of course, then when it became so prevalent in the United States, it was really kind of scary. So, I really believe if I wasn't pregnant, if it were just me, I have a strong immune system. I eat mostly carnivore if I wasn't pregnant, and I would be fairly well positioned to deal with the infection if I did get exposed. But being pregnant, obviously, that's just a whole nother level of concern that any mother would have. So once it really got bad, and my company actually put a stop to all travel, is when I really got serious about staying home, because I just didn't want any of the extra exposure. So I think I was home. It was something we were counting like 37 days straight where I didn't leave like the premise. I took the dog out for walks, but that was it. I didn't physically drive out or wander out beyond our, little cul-de-sac area of walking the dog. So it was really worrisome to me at that point. But again, I wasn't sure that I hadn't already been exposed either, but the testing situation wouldn't allow me to prove that or not. So And then, as of late, obviously I've gone out a few times. I still am kind of worried about, I still don't shop. I'm having my groceries ordered in. But we've done a few things with neighbors who we obviously know are not symptomatic. And I actually do take people's temperatures. So just a little
worried. Over there, put it on their head.
But we know that they're being really cautious as well. So, and we've kept our social distance. So, so we've been exposed a little bit. But baby shower, that's what you asked about, is an interesting topic, because I do have friends that are like, oh, we so desperately want to see you, want to see your bump. We want to see you open your gifts, etc. My sister is wonderful, and she is, everybody knows, my sister knows, she's the planner of all planners. So she plans things 4 years in advance, and they happen on the date to the T of the way she planned it. So she's one of those people that the plan always falls into place. And so she's taken over planning a virtual baby shower. So that's what the plan is. And I think it'll be wonderful. You just have to always say there's a silver lining to everything. And I'm still so blessed that I have friends and family who'd be willing to sit on a electronic platform with me for an hour to celebrate, our upcoming baby. So I'm just so thankful for that. And yeah, but it's a different time for sure. What about you? Doing a baby shower?
Yeah, it's actually tomorrow.
Oh my gosh.
So before this, I was getting all the gifts out, and I'm putting them on the bed so that I can kind of like scan them for the video or whatever. So, yeah, I think a couple of my neighbors are going to stop by afterwards, but that's about it. So, yeah, I think it'll be fun. I don't know. It feels like almost like I'm working, because that's what I do for work. So it's like, okay. But I mean, it'll be my aunts and grandmas and stuff. So it'll be nice.
Will your mom and there?
My mom, I have actually two moms. So I have stepmom and a mom, and my mom is coming, and then my best friend is coming over. So they're going to like help me a little bit.
That's wonderful. See, my parents and my sister live in Colorado. So I think I'm just going to be sitting there all by myself. But like I said, we're still very thankful.
Yeah, I mean, it's kind of, people are starting to get together a little more, but I also don't think I would be comfortable having like 30 or 40 people over. So, so it's kind of like we're still in between,
Right.
Well, stand up so we can see your bump.
Wasn't prepared for this.
You don't have to.
Let's see.
Okay.
My big shirt here, but yeah. So that's my belly.
Good. Okay. I think I'm bigger than you.
I don't know. It's like I kept thinking, some of the measurements that they were doing on ultrasounds early on, I kept thinking, oh, our baby's gonna be a midget. His femurs aren't that long, etc. So he might be tiny, but we'll see. We'll see. My husband's tall, so I'm praying he catches up.
Well, you're probably tall too if you play volleyball.
No, I'm short.
Okay.
I'm 5'4", but I can. That's why I was able to play volleyball. You have to be scrappy when you're short.
To jump a lot.
Yeah.
Okay, well, I'm just so excited for you guys. I mean, it's great. You're kind of having a second chance at everything. So that's great. Yeah, we've actually been married for 14 years. So.
Ow!
Yeah.
Wow.
And so we've been thinking about this for quite a while. Yes, this is my first child.
You had a long time to get ready.
Yeah, we've had a lot of time to prepare ourselves. So, well, congratulations. And you guys, if you have any more questions, just leave them down below, and I can ask Dr. Robert when I interview him. So leave your questions about this topic or any other keto carnivore topics down below, and we will ask Dr. Robert when he comes on. So stay tuned for that. Make sure you subscribe to my channel. If you have a friend who is following standard American diet and they are having trouble conceiving, share this video with them. I think it'd be really helpful. And do you have any closing words for like giving couples that are maybe struggling some advice?
I mean, I would just say, like I said, don't lose hope. And I think, you know, take the dietary nutritional advice from these platforms. It's gaining so much momentum out there. People like you, Caitlin, are just wonderful for spreading the word, spreading the lifestyle choices, because I do think it can be so helpful to so many people. So, you know, get as much information as you can, as much knowledge as you can, really make an educated decision for you and your partner, and then just stay hopeful.
Yeah, that's great advice. So it was great to talk to you, Janae, and I really appreciate it. And we'll see you next time. Bye-bye.